Welcome to Disrupt Healthtech, the podcast where we dive deep into the innovations transforming healthcare. I'm your host, Wendy Austin, and today's segment is a part of a 6-part series titled Building Healthtech from Concept to Care. Within 6 episodes, we'll peel back the layers of what it truly takes to bring groundbreaking health technology to life, from the initial spark of the idea through vigorous clinical validation, smart product management, strategic sales, effective marketing, and powerful analytics. We'll cover the entire life cycle. So whether you're an entrepreneur, an investor, a healthcare professional, or simply curious about the future of medicine, this is your essential guide to understanding how health tech moves from visionary concept all the way to delivering real-world care. Let's get started. Another episode of Disrupt Healthtech. I am your host, Wendy Austin, and today we're going to dive into the fascinating world of product management and health tech. With me today is Ramin Rasoulian from Kandu to talk about the process of taking a health tech product from idea to commercialization. Ramin, would you like to introduce yourself and tell us about your background?
Sure. Thanks, Wendy, and appreciate you having me on the podcast here. So my name is Ramin, and I have about 14 years of experience in health tech, pretty much all within a product management capacity. My educational background is mechanical engineering, although what I do today has nothing to do with that. And it was basically my first role at Epic, actually, that got me into the world of digital health and health tech. And, I kind of was transitioning into like biomechanics, and Epic came to our school career fair, and I was like, oh, cool, healthcare technology, let's give it a shot. And it was a really fun experience at Epic. It was a great foray into the US healthcare system, a lot of great learning, but also working a lot with hospitals who, were initially trying to implement Epic and mostly on the outpatient side. So I got a really good experience in working with different administrators, different clinicians, and different specialties. And from there, got into a little bit of analytics consulting for pharma companies, back-end data management, front-end data visualizations, a lot of interesting prototyping. And then I moved to LA, and that's where I joined Cedars-Sinai Hospital here. And initially, focusing on Epic implementations, again, mostly for a couple of outpatient clinics that Cedars had acquired in oncology and orthopedics, a lot of work with primary care. And then last couple of years of my career at Cedars, I transitioned more to the patient-facing side of things and consumer digital innovation. And I managed our patient-facing applications and also worked a lot with startups who came through in the accelerator program at Cedars. And that was a really exciting time. I got to see a lot of cool startups bringing their interesting ideas and, how do you integrate those products into the ecosystem of the hospital, both from a technical perspective into Epic, but also from, integration to clinical workflows, finding the right clinic to pilot it in, measuring outcomes and really showing the value of these startups on top of Epic. And so at that time, I was like, I want to join a startup myself and really use my skill set to build something from scratch. And so this opportunity that I'm at currently popped up a few years ago, and I'm very grateful for it. And I have the privilege to be able to build, essentially lead the development of a post-discharge care navigation platform for stroke survivors and their caregivers. And what we do at Kandu, very exciting. We help stroke survivors and their families get back to life. It's a very difficult time in their lives. And so we've built this, proprietary flat platform from the ground up. And today we work very closely with stroke survivors as a tech-enabled service. So we have a very important clinical component service that's essentially powered through technology.
Yes, very good, very good. So can you kind of describe what factors go into the decision-making process when creating a product, especially in the health tech arena? Things like compliance are very important, tech stack, obviously, but some others that you might know of?
Absolutely. And I'm going to this is something that I say often, and I might sound like a broken record by the time we end this podcast, but I always say it's really important to focus on the problem first, before you get into those other factors, which are absolutely very important. It's so imperative to really make sure that you have a good understanding of the problem that you're trying to solve in the first place. There's a saying I like to say, which is fall in love with the problem, not the solution necessarily.
Yes, very nice.
So what that means is, start with strong research. Really understand who is this product that you're building for? Is it directly for patients? Is it for clinicians? Is it for administrators? Is it for payers? And really get deep into that understanding of the problem. Make sure that you're, talking to your end users, and we can talk more about this, as we go on. But and not just doing the research, but also synthesizing that feedback that you're getting is really important. Making sure that you're identifying the themes that you found and heard through that research, whether it's focus groups, one-on-one interviews, surveys. That I think any health tech product, and frankly any product, but probably more so in health tech, it's really important to understand the problem that you're trying to solve and really talk with your end users. From there, I think it's really important to bring in the market and the business layer of it. In healthcare, it's sometimes difficult to figure out how you're going to make money. It's really important to understand the flow of money in healthcare. From payers to hospitals, patients. Is this cash pay? Is this? Are you going to bill insurance? And so it's really important to layer in that aspect of the commercial side and who's going to be buying the product, but also who's going to be the user, which are not always the same, in healthcare. And really making sure to quantify the value that you're bringing to the table. Thinking about the models, again, is this direct to consumer? Are you going B2B to C? Is this a B2B SaaS play? And so, start with the problem, think about the business aspects. But then, as you said, sometimes that's not even enough. And you're going to really have to think about the regulatory and compliance aspects of the problem. You're going to really need to think about clinical validation. Typically, any health tech product, there will need to be some sort of clinical outcome at the end of the day. So it's really important to think about data collection from a regulatory perspective, data privacy, but also from an outcomes perspective. How are you going to collect data? How are you going to, what are some of the metrics and outcomes that you need to be able to prove? And then lastly, I think I kind of alluded to this early on, but how is your product going to integrate with real world, workflows within care delivery systems? You can have the best, you've figured out the right problem to solve. You have the best product. You have you understand how the money is going to work. And then you bring it inside of, let's say, a hospital or a health system, and it just doesn't fit necessarily because you haven't done the research and really spent the time to work with the people on the ground to figure out how am I going to fit this thing into their workflow. So that's another really important element to consider. You alluded to tech stack. That's obviously very important. It kind of, dovetails with what I was mentioning about the integrations. It really depends on the product, when it comes to the tech stack. Again, you really need to understand your user. And obviously, you're going to need to, at some point, think about scalability, the security aspects of it, data privacy, but also integration with, like I said, existing systems. Do you need to integrate with an EHR? Like an Epic or a Cerner or, a lot of these other EHRs out there. Interoperability, again, it really depends. And integration with EHRs might sound something very difficult and challenging. And yes, it can be, but it doesn't have to be. There's different layers and levels of integration with EHRs. It can mean different things. You can go super simple, all the way to very deeply integrated, FHIR integrations and things like that. So it's also, as you're building your tech stack, it's really important to figure out not just the tech stack that I'm building for my own product, but also how is this going to integrate with, existing systems out there? And am I going to be deeply integrated with the hospital? Or no, is this more of a direct-to-consumer sort of product that patients are just going to use directly? But yeah, like I said, data strategy is also just important, another factor to really consider as you're building a product. And I would try to, in addition to the standard sort of usage metrics and engagement metrics that pretty much any product out there tracks, it's really important to understand the clinical outcomes and the business outcomes. And thinking about those at every stage, when you're starting out, you have a different set of clinical and business outcome metrics than when you're, let's say, 3 years into it, right? So early on, it's so you have to think about what is the necessary data that I need to collect at this stage of the company to get me to the next stage. When you're just starting, maybe 50 patients is enough. 3 years from now, you might need 2,000 patients worth of data. So just thinking about that data strategy.
Yeah, that's very good. So, let me talk about the first part of what you talked to, which is the market research portion of it, or any kind of research. Maybe it's not market yet because they haven't really identified the market yet, but how would they go about, or maybe the question is really not so much how you do the market research correctly, but maybe it's more of when should they start doing research? At what point of the ideation, or after they have somewhat of a clue of what they want to do and they want to take that to the market and test that out? Like, when do you think that research really begins?
Yeah, from day one, in my opinion, day zero, I would even say, a lot of time, typically, founder will have some idea of what they're trying to build, in their head. Rarely do you start with nothing. So it's either a personal experience that you've had as a patient, or you've worked at another company, you've observed a problem, and you're not, and now you're thinking, oh, well, I think I can solve that problem. But I would say from day one, talk to people, like, especially in healthcare. One of the things that I see lacking, frankly, Wendy, is that people come in and they have this notion of, okay, technology can really disrupt healthcare and move fast and break things. And that just does not work in healthcare, because it's complex. And why is it complex? Because there's so many different, players. There's different motivations. Patients look at healthcare differently than maybe clinicians. The problems that each one of these patients face are sometimes different, and sometimes opposite and contradictory to the problems that clinicians face day to day. So, it's never too early to talk with users. And really, I think it's important to be able to segment your stakeholders, figuring out, okay, is this whatever I'm building or the problem that I'm focusing on, is it 70% patients? Is it 20% clinicians and 10%, payers? Or what I'm building, is it more 80% for payers and 10%, right? It's important to segment, but also just do a rough analysis of, like, who's the most important player and to what extent. And so, if you determine that, yes, this is a product that mostly patients will be using directly, but that I may have some sort of a selling component to hospitals, okay, sort of like, analyze that and make sure that you're spending the right amount of time proportionately based on, your stakeholders. And so, I would just say there's no early time, to talk with and do that research, essentially.
Okay. So I get that. Let me now dive into I would say, maybe systematic market research or the formal market research. At what point do you feel like it's the right time, and how to conduct that type of research that would really allow a company to understand that they are on the right track with not only who they're trying to market to, or if they're actually solving the problem? When do you think that comes into play, and what do you think the best approach to market research really is from a formal perspective?
Yeah, and it's an iterative process, right? So typically you want to start with some very, maybe, let's say, qualitative research, like I said early on, talk with, interviews with users, shadow and observe clinicians, talk to folks at payer systems, and then just try, create a prototype and just test it out, test it with real world users, whether it's patients or clinicians or whoever it may be. I think, from my perspective, doing a little bit of that more formal sort of market research probably will come into play once you've had an initial MVP sort of
Okay.
done, or at least an initial prototype sort of completed. Like I
Right.
said, maybe you've tried it with 50 patients. You've collected some initial data. So you've done sort of, you have a sense of the market. You've done some exploration of like, okay, how am I going to make money off of this? I've
Yeah.
heard from some people that, okay, I might be willing to pay for this if your product can do A, B, or C. You've tested your product, or it could just be a simple prototype with a small number of users, and you've started to validate that what you heard initially through those qualitative interviews actually holds weight now, and you're starting to see the evidence of that. I think that's really a good opportunity now to really elevate that research and go into more of a little bit more of a formal sort of like, quantitative research. Look at claims data, look at EMR data sets if you can identify any. Public health resources, the CMS website has a lot of good data out there. And be able to take the real world data, mash it up against the qualitative interviews, and then start to see, okay, with these larger data sets, is what I saw in my prototype and my product, does it hold weight now? For example, if you're looking at let's say a specific population, I'll use the example of stroke survivors. Looking
Yes.
at, for example, there's a lot of data sets out there, again, CMS website, that can tell you how much cost, is there to the health systems or to payers in the first year after a stroke. Quantify
Right.
that. Take,
Right.
try to for patients above 65 years old, under 65. And start to look at the value that your product is bringing relative to the cost that it's bringing to the payers, essentially. And I think that's really a good opportunity to again, iteratively making sure that what you tested and the data that you collected early on actually makes sense now.
Yeah, very good. So I'm going to skip the whole, implementation side, because I think that's like a whole different area in terms of, building the product and a lot of other teams other than product managers. But let's kind of jump, if you will, from doing that market research. Obviously, there's optimization that happens with that as you're building out different versions of the product. But let's talk about commercialization. And you alluded to it a bit when you were talking about market research. At some point, you start to get a sense of how you're going to sell the product, right? Oftentimes, tech companies kind of get stuck at this commercialization step. But in your opinion, what makes or breaks that commercialization step for health tech companies?
Yeah, that's a great question, Wendy. And I think a very important one as well.
Yeah.
In my experience, it's usually it's not because the tech doesn't work.
Yeah.
Oftentimes the tech works, right? Sure, like there's always improvements that you can make to the technology, always improvements that can be made to the product, but that's not the main reason. What I find that, a few main elements that break sort of, the company at that stage is the fact that they just didn't plan for the complexities of adoption, the
Right.
complexities of the
Right.
reimbursement pathways, and really truly going deep and understanding, again, the flow of money in healthcare. I keep saying that, but it's really understanding who pays for what, why, what are the incentives for clinicians to do something? How do patients think about paying for healthcare?
Yeah.
In the
Yeah.
US, especially, it's a specific mindset. What do
Yeah.
patients expect to be covered
Yeah.
under insurance? You might launch a cash pay business, but you start to see that, hey, patients aren't willing to pay because,
Yeah.
hey, the patient was expecting that this should be covered under insurance.
Yeah. Yeah.
That's not always true. There are certain things that patients will pay for out of pocket, but that's why it's so important to understand that behavior and that mindset. It's really, an element of psychology as well,
Yeah.
in addition to understanding the flow of money. But and I think the other aspect of it is trust building.
Yeah.
You have
Yeah.
to be able to establish trust with clinicians. You can't just come in as a tech company and say, "Hey, I built this great tech. All right, why isn't everyone
Yeah.
taking it like immediately right now?" Well, it's hard to establish that trust. It's hard to
Yeah.
both with patients and with clinicians and with payers. So I think what's really important is to establish, one, that trust and that evidence, really. So,
Yeah.
from a clinical perspective, validate your product clinically, validate the outcomes, whether it's through randomized controlled trials, whether it's through, collecting real world data, as I mentioned, first 50 patients, first 100 patients, and making sure that you're collecting the right data. There's so much data that you can collect. It's not just about usage and engagement. Like, a lot of tech companies, a lot of their data is about daily active users, monthly active users. That's good and all, but that's not necessarily what a clinician or a hospital administrator is necessarily excited about. It's at the end of the day, what outcomes did you bring, with your product? What outcomes were you able to gain? Did my patient get better? And how do you define that? What does better mean in that context?
Yeah, that's so true.
Being able to define that through whether it's assessments, whether it's through, standardized assessments, that there's a ton out there. I'm not going to, talk through them all, but, there's different measures from a mental health perspective, physical health perspective, out there that can be used to measure outcomes. So it's important really to understand, again, from the people who are buying your product, what's the data that's important for them? And again, being able to establish that evidence. Regulatory approvals, making sure that if your product is, let's say, a medical device or software as a medical device, making sure that you understand the regulatory pathway. And again, establishing that trust with the people who are buying it. If you need FDA approvals or FDA clearances, like what's the pathway to get there, and planning for that early on. I think it's also just being able to understand and talk the lingo. When you're in front of a doctor, you can't speak too much in technical terms. You can't speak too much with like, engagement and things like that. You have to really be able to understand their world, and they might be throwing out, there's a lot of 3-letter and 4-letter acronyms in healthcare out there, CMS and, this and that. And having worked at Epic, these 3-letter acronyms just, it's everything that and it's really important. Yeah, exactly. And it's really important to understand that and really know who you're talking to. If you're talking with that, head physician of a practice versus the administrator of that practice versus the VP over the service line at a hospital versus a medical assistant versus a, physician assistant, every one of those has a different mindset and a different way of engaging. So a lot of what I did at Cedars-Sinai was really also just understanding who I'm talking to. I was on the ground at these clinics, for a couple years, day in and day out, from 9 to 5, every single day. And I just was able to observe a lot of how they talk to each other, how different roles, what are the different sort of acronyms that they use? What are the different things that they constantly care about? So again, it's really important to be able to establish that trust and evidence. I think another thing, again, from a commercialization perspective, I kind of alluded to this again, but you just need to have a clear path and understanding of who's going to pay for your product. You're going to have to understand CPT codes. You're going to have to understand DRGs. You're going to have to understand probably value-based care. Even if your product it isn't directly impacting that, there are indirect sort of adjacencies and periphery pathways from reimbursement that can affect all of this. So as someone building in health tech, it's so important to understand this. Employer self-insured incentives, what sort of, how do they think about this? Again, like cash pay and direct to consumer, again, if this is a product that's for patients, which a lot of, products in healthcare are, that's a good way to start. Let me go through direct to consumer channels. Let me get patients. Let me try a cash pay opportunity. But it's typically difficult to sustain that, right? And that might work for the first 50 patients, and it's good. Not at all a bad way to start your product and get patients, a few patients to pay for it, collect some data. But you're going to really have to understand that may not be a sustainable way of making money. So what might work for day one may not work, a year from now. And also for like collect, to get investment from investors also, it's really important to understand, how are investors looking at the cash pay business? Again, early on, a great way to start, but cash pay, it's difficult to regularly get those recurring patients in. So you're going to have to start thinking about selling maybe to, how do I partner with different entities in the healthcare system, whether it's hospitals, whether it's, potential rehab groups, whether it's, payers, will a payer pay for this eventually? And really understanding, again, what is it that they need to be able to pay for it. Selling to hospitals will take a long time. It's not a 1 month sales cycle. Sometimes it's not a 6 month sales cycle.
Yeah.
It can easily be
Yeah.
12 to 18 months. Yeah.
Yeah.
So you're going to have to
Yeah.
plan for that. Payers, they need a really good amount of evidence, for example.
Yeah. So, all right. So let me kind of back up a bit. So we're talking health tech. A lot of people that are, typical kind of CEOs of a health tech company are, technologists, right? And so what do you think their best way to understand how their product is going to get used and ultimately get revenue for that product? Is it hiring somebody on the board or on staff that really understands healthcare, or is it really doing a lot of the market research or investing in people like ourselves on the product teams that really understand healthcare and health tech? What do you think the best approach for them might be in order to kind of make sure that they understand that they're building the right product that will ultimately get them revenue?
Yeah, good question. I think, the answer to that question will also depend on where you are at the stage of your company and sort of the amount of funding that you have. Early on, I think it's really important to maybe not necessarily a full-time hire, but work with consultants out there. Talk with other founders. There's a lot of great communities out there, and there's a lot of good in the health tech space. There's Slack communities that where you can talk with other founders and start to get an initial sort of sense of what you're building. Am I on the right track? Does this sound right? Cash pay, direct to consumer. Is that the right approach for my product early on? Or should I really be leaning into selling to health systems or payers? There's a lot of good consultants out there that can sort of do a packaged approach of let me help you understand sort of the healthcare commercialization approach of things.
Right.
But I also think as a founder, it's not something, especially early on, I don't think it's something you want to outsource necessarily either. It's something that you have to be in the trenches. You have to really understand that yourself. So, but yes, it's also very difficult to get a lot of this information through just, Googling or whatever. And so that's why I think partnering with either a consultant or networking, the power of networking, it is amazing. And frankly, early on in my career, I did not realize the power of networking. And, I thought, well, okay, how is networking going to help me? And I'm just doing my job day in and day out. But over the course of my career, I frankly realized how important it is to be able to talk to people, understand their products. How did they go about building it? Where did they fail? Look at case studies, look at a company, a sample company that's maybe adjacent or a competitor to what you're building, and try to understand what they developed. What was the approach that they took? Why did they struggle? And so I think learning from the past, learning from others is just always a very important step in your commercialization process.
Right. Very good. Okay. So with your experience as a product manager and product management teams, what is the most important part to get right when developing a health tech product?
Yeah. Again, I'm going to sound like a broken record, but understanding the original problem. It's just so important to make sure that you got it right, and it's not a one-time exercise. It's an ongoing iterative approach. So I think as a product management team, you're going to really need to be able to bake that into your mindset. I learned something day one. I understood the problem. I built something. I get it tested. That doesn't mean that understanding the problem stops there. You've got to continuously talk to your users, talk to patients, talk to your clinicians. As you hire more people in your company, talk to them, whether it's salespeople, whether you have internal clinicians, whether you have, whoever it may be, talk to your internal users as well, and really make sure that you understand the problem. And, look at it from all the different perspectives and make sure you got the right stakeholders. Again, I keep saying this, but in healthcare, it might seem like, okay, well, there's patients and clinicians, and that, yes, generally that's true, but understanding the motivations of each one of those, super important. So I think it's just one, really important that you make sure you get the product right, you understand your users, and you understand the stakeholders.
Yeah.
Designing for evidence from the start. Again, I've mentioned this, the data collection, making sure that you have the right evidence, but making sure that you design your product so that you can easily, quickly, and scalably collect the data that you need. Again, whether it's clinical outcomes, real world evidence, whether it's the business outcomes, how many users are in my platform, basic things like how much are they using it, but should I put in assessments, clinical assessments, validated assessments to be able to collect or measure how they were doing from day one through day, 90 or day
Yeah.
180 of usage of the product. And again, it's I keep saying this, but understanding that reimbursement landscape, understanding the flow of money. As product managers, you can't, bury your head in the sand and just build a product and expect everyone to use it. You're gonna really have to understand that aspect of it, and just really making sure not to neglect the regulatory and compliance aspect of it. Typically you're gonna have to deal with HIPAA, sometimes consumer privacy laws, sometimes FDA, depending on what you're building. But it's really good as a product manager to just educate yourself. What does HIPAA mean? And it's not frankly, like, it's not something to be scared of, and it's, I think, important to embrace it as well. Like, in some cases it can be beneficial. It can actually add trust to your product and add credibility to your product, which is important when you go out and sell it. So I think those are important as a product manager to think about.
Yeah. It's very interesting you should say that, because one of the beliefs that I have through my career as product manager is to tackle the hardest part first, because I know from my own experience that when I was early on in my career, if you kind of ignored the big thing that you knew needed to happen eventually, then you might get to a point where you've designed and developed potentially a solution that is in kind of an ideal state, and doesn't take into account like who's going to ultimately pay for this, or if there's a compliance that you need to really be taking and putting that into the product from the very beginning. So then you get to this point where your product's built here and it needed to be here, and there's a mismatch, right? So
exactly.
I totally understand what you're saying.
And it becomes really costly at that point, to redo it.
And then
it's just,
you're down a path that now you need to either just totally revamp everything, or kind of tack on additional modules or something that just now becomes unintuitive for a user to actually use the product.
Exactly, which is why it's so important to take, an agile approach and make sure that you're, iterating often and creating different prototypes. Talk again, I keep saying, talking to users, show them something. Is this work? Do surveys, do interviews, do focus groups, and just continuously get feedback.
Yeah, exactly. All right. So any parting words to other health tech product management teams out there on how to successfully launch the next great health tech innovation?
I think I have a few. The most important, just be patient. Healthcare is hard. It's not easy, but it's really important to have that, deep empathy towards patients and towards physicians. Just get as close to their experience as you can, I know it takes a little bit more time up front, and it takes investment of, again, time and money, but it's really worth it. It is truly worth it. And there's a reason, again, why big tech hasn't been able to break things and move fast. And so embrace that. Maintain your focus and just be disciplined in your execution. Again, it's going to take time, but there's also a lot of distractions and noise that can exist in health. And really, this is for any product, but just making sure that you're focused. There's a lot of good communities out there that you can join. Like I said, Slack communities, and just talk to as many people you can, other founders, other people who have tried to build in your space. Find good consultants or experts, pay them a little bit of money maybe early on to sort of get some of their consulting advice. And I think, it's going back to the first point that I was making about being patient. It it can take a long time sometimes, right, to build a product and to get the people who are going to be willing to pay for it. And it's going to feel slow at times, but it is
Right.
truly worth it. And the satisfaction that you can get from, helping people who are frankly struggling at a difficult time in their lives, or, that are just going through something difficult, it's unbeatable. There's
Right.
no other industry where, in my opinion, you can get that satisfaction. And so the last parting thought is just don't forget that your product might not just change lives, but it might actually save them.
Yes, exactly. All right. So, speaking of your current company, Kandu, why don't you tell us a bit about what you're doing there with stroke patients, and let us understand what you're doing in terms of saving lives.
Sure. Thank you, Wendy, for that opportunity. I kind of mentioned at the beginning, but we are essentially so Kandu Health Legacy post-discharge care navigation service for stroke
Right.
survivors. And we partner with hospitals and healthcare systems. We partner with their stroke departments, when a patient's had a stroke. A lot of times, the discharge journey and the recovery journey is not it's very difficult. And that was a lot of time that I spent with stroke survivors early on to understand their problems, understand their needs, understand their challenges, which is why I kept saying it today, and through that early research, what we found is that patients oftentimes struggle with even education about their stroke, education about what's next, education about both for their caregivers and for the stroke survivors. As a caregiver, how should I be helping the stroke survivor if I'm, the spouse, a parent, a child? Like, how do I prepare for my doctor's appointments? Which doctor am I supposed to go to? Am I supposed to go to a neurologist? Am I supposed to see an occupational therapist, a physical therapist? So just educating me about the different sort of doctors that are going to be involved in my care. When I get home, what's the first thing I should do, in terms of looking at my living situation, my maybe I need to get back to work. How do I get back to work after a stroke? How do I drive after a stroke? How do I talk to other people about my stroke so that, I can explain to them what's going on? And, stroke is very heterogeneous depending on what part of the brain's been impacted. You can have cognitive, deficits, you can have physical deficits. So it varies a lot. You might look at someone who's had a stroke, you would never know that they had a stroke. But once they start talking to you, that's when you might realize it. So it's really important for a stroke survivor. And there is also a sense of loss of identity after a stroke as well. That happens with some
Yeah.
folks. And so a lot of what we do is supporting the stroke survivor and their family through all of this. It's a
Okay.
lot of what I would say the soft aspects of medical care
Right.
that, a lot of it's unfortunately because the healthcare system is so focused on discharging
Yes.
the patient and making sure they got the right meds. And,
Yeah.
that's what they focus on, but they don't unfortunately have the time sometimes or the tools or the resources to be able to focus on a lot of this. So that's what we do at, Legacy Kandu. We just, by the way, merged with a medical device company officially 2 weeks ago called Neurolutions. And so the merged entity is now called Kandu.
Okay.
So not Kandu Health anymore, but just Kandu Inc. And
Okay.
Neurolutions has an upper extremity brain-computer interface, basically device for stroke survivors who've lost function in their arm after a stroke. This device comprises of an EEG headset. There's an arm, a robotic arm that fits onto the, the survivor's arm, the one where they've lost function in. And there's a tablet that controls the sort of the experience essentially. And what it does is that by after a stroke, typically the arm is fine. It's not the arm that's an issue. That's the issue. It's the neural pathways between the brain and the arm that have been disrupted. And so what this device does is that it takes signals that are still in the brain and it converts them to movement. So, you think that you want to move your arm, and the device actually moves your fingers and your arm for you. And through the concept of neuroplasticity, the idea is that by repetition and by regular exercises of trying to move your arm, the brain can regain and reestablish those neural connections that have been disrupted after a stroke. And so, the merged entity of Kandu is now, we're still doing the tech-enabled services for stroke survivors who have just had a stroke, but for those who now have an upper extremity deficit after stroke, we can now provide them with these new breakthrough technologies.
All right, very good. So thank you so much for your time today, Ramin. I really enjoyed our discussion today about how product teams can take ideas all the way to commercialization. For more information about either Disrupt Healthtech or Kandu, please see the links below. And thank you so much for attending today, and see you next episode.
All right. Thank you so much, Wendy, for having me. It was really great talking with you today.
Thank you. Remember, this is just one episode of a 6-part series, and each one will bring you closer to understanding the full picture of health tech innovation. You won't want to miss all 6. Please be sure to subscribe to Disrupt Healthtech so you don't miss a single episode of the series Building Health Tech from Concept to Care. Thank you so much for listening, and join us next time for more insights into the future of healthcare technology.